Welcome to another episode of Caribbean Medical TV. Today, we're getting to the very core of your physical health, the very essence that guides you through life, the heart. While the Caribbean is unique in many ways, we unite with the rest of the world in the rise of one of the most common chronic health conditions, heart disease. Many of our Caribbean people, some unknowingly, are living with heart disease or know someone with this ailment. Unsurprisingly, this condition can influence our peace, our professions, our families, in short, our entire lives.
Heart have 3 arteries and 2 arteries in the left side. That is what we call a left main coronary artery. It divides into 2. One is a left anterior descending artery, which supplies the blood, supplies to the heart muscle, 60% of the heart muscle. And then the left circumflex artery, which supplies to the 20% of the left side of the artery. And then right side, right coronary artery, we call it as, it supplies to the 20% of the heart muscle. So in total, 3 arteries supplies 100% of the heart muscle. So main one is LAD, that is left anterior descending artery. Left circumflex, right coronary artery supplies to 20% each. The heart is the main one, pump the blood to different parts of the body. So the artery is supposed to be healthy and nice.
The causes of heart disease are no mystery. Unfortunately, the risk factors are very common in our communities.
There has been a decline in mortality, but that decline plateaued around 2019, 2020, and in fact has started to increase again. Some of that was due to the excess mortality due to the COVID pandemic, but on top of that, there's been the epidemic of obesity and diabetes that is an added risk factor, and thus cardiovascular disease has trended up over the last few years in cardiovascular disease mortality. So we still have a lot of work to do here in the Caribbean and around the world.
Heart failure and cardiovascular disease are related. This is like a journey in the illness of the patient. The patient starts in a point to have something that we call risk factors. For example, elevated high blood pressure that we call hypertension, or high cholesterol, or diabetes. That leads to changes in the heart and the arteries. A concept, for example, that our arteries getting older, stiffy, and with atherosclerosis. Finally, complications arise. For example, cerebrovascular disease, stroke, heart failure, or kidney problems. If they are not addressed in the right manner, the patient can lead to very limited quality of life, or unfortunately, some of them lost their life. Every person is an individual, but definitely having risk factors, high blood pressure, high cholesterol, smoking, and diabetes are the person that can lead to heart failure. If the heart failure is not addressed or treated, the person, 50% of the persons die in the 5 years after the diagnosis.
Because there are sometimes no warning symptoms, many people are unaware they are at risk for heart problems. The key to prevention is being prepared.
We had a 25-year-old young man recently who had no clue that he had anything. And when I listened, I heard the murmur of mitral stenosis, meaning that his mitral valve, the one on the left side between the top and bottom, wasn't opening. And when we did the echo, it showed that he had severe stenosis, and he's 25 and never had a clue that he had this disease. So we can go on forever with these stories, but what we're saying is if you identify, if you keep doing well-person checks, something will tip somebody off that something is wrong. Children have to be seen by a pediatrician or a GP or somebody who is listening for abnormalities, not just, getting vaccines and done, but listening for a murmur or alert to the fact that a rash could be more than a rash, right? Just thinking of the diagnosis, because we say what you don't think of, you'll miss in terms of diagnosing. So if you do that, then there's a possibility.
Unfortunately, I am seeing the incidence going up, and I'm seeing it in the younger patients. For example, I trained in the University of Calgary in Canada, And in my training, when I did these procedures, I did it in patients who were in 60s, 70s. But in Guyana, I am doing procedures or these stents on patients as young as 30s and in their 40s. And we did a study in between 2022 to 2023, where we looked at about 230 patients who presented with this type of heart attack. We found that the average age was in the 50s. We found that they were predominantly male patients, and a significant portion, almost 70%, were South Asians or East Indians. A lot of patients had diabetes, hypertension, and 80% of the patients presented late and did not receive the therapy within the 12-hour period.
The good news is that detection and treatment have been increasing in the Caribbean. The heart patient of today has more options than the heart patient of decades ago.
I think as a whole that the Caribbean is actually quite good at healthcare. So certain territories might be better at certain things, but we haven't had to send patients away for a long time actually. In terms of cardiovascular care specifically, we probably only sell pediatric cases for surgery. A lot of the pediatric cases are done by something called interventional procedures as well, and those patients do not have to go away. Adult cardiology patients do not go away for anything, so angioplasty, stents, surgical procedures including valve replacement and valve procedures, and this is within the Caribbean as a whole. So, and Trinidad specifically, quite in a good way, has a highest per capita of cardiologists in English-speaking Caribbean. So we have essentially all the cardiology specialties, locally. But a lot of people in their 30s and their 40s and their 50s don't think of healthcare as being part of a proactive thing. So they're waiting for something to happen, then go to the doctor. So we see both in men and women that, the suddenness of cardiovascular disease. And it's one of those weird things that you have to look for. You can't just say, I'm waiting for a symptom, then to do a test. So it does mean going to your doctor, having a frank discussion. Again, it makes a difference what we're looking for. So if somebody has heart disease in the family, we might look a certain way. If it's a general checkup, it might be just a different way of testing. But we have the technology. This is not that it's unique to some parts of the world. We have different ways of evaluation. We have CT scans, MRI machines, echo machines. So technology is available in the Caribbean. It is not unique to some other part of the world. We can do it. People just need to access it and again have that discussion with the healthcare provider, wherever you are, and see what is the best tool for you to come up with that information.
In the Caribbean, we do have different levels of equipment availability and access in the different territories, right? So part of what the Caribbean Cardiac Society does is brings together that network, kind of strengthen that network, establish that network.
There's some areas that they may not require setting up of a special area in each country. So by meeting together, the team might say, listen, we are setting up this center for maybe PET scanning, and we would encourage from all the other islands that you could come here. Another center might decide, well, look, we are going to do a lot of coronary intervention, and difficult cases, you could bring them here. So you could have centers of excellence in different fields around the Caribbean.
Relatively recently in St. Lucia established this cardiac catheterization laboratory. And what we did is that we had, persons coming from Martinique, persons coming from Jamaica, and it would have been cardiologists, cardiovascular nurses, cardiovascular technicians traveling to help establish that cardiac catheterization center in St. Lucia. And that's what we like to do. We like to build capacity in the different regions, and yes, there is human resource capacity, but we know that the equipment and the availability of disposals and so on are also very important.
In the last years, we have faced the appearance of diverse drugs for treating common diseases, diabetes, hypertension, obesity. When we take a look at those patients with obesity, hypertension, diabetes usually suffers not only for that condition, but also affects heart, kidneys, liver, and other organs. And that's the point when we, the different specialists, get together to treat the same patients. And in the last year, all of these medications usually works not in only one organ. Let me give you an example. We have some molecules that can protect the heart at the same time that they protect the kidney and at the same time that they protect the liver. So it is important to have the different specialist perspective of using this medication and the management of this problem.
Beyond those traditional drugs that have been the cornerstone There are new technologies that have to do with genetically manufactured or genetic alterations or new medicines that are based on gene technology. And the fact that the human genome has been identified and we can now have the technology to know the genes responsible. Scientists are now making gene therapies, antibodies that can target certain molecules in the body to bring down the cholesterol. It's quite amazing. And it resembles in many ways some of the advanced drug technologies that are used in cancer therapy, where you can target the focus. This is now being applied in cardiology.
What I presented was the work that we are doing in managing heart attacks. And there's one particular heart attack called a STEMI, ST elevation myocardial infarction. And what happens in that case is that the artery becomes blocked 100%. So when that happens, patients will obviously get significant chest pains, is that you have to open that artery as soon as possible. And the earlier you open that artery, the better the outcomes. So if you open that artery within 3 hours, you have a better chance. But there are certain therapies that you can give that would have to be given within 12 hours. In addition to that, the gold standard is actually taking the patient to the cath lab and trying to open that artery with a balloon. That is called PCI. So my presentation was based on the work we're doing in trying to have this therapy available in all the 10 regions of Guyana.
My area of focus is minimally invasive heart procedures, really percutaneous heart procedures, meaning doing heart valves or closing holes in the heart by just going through either an artery or the vein in the leg. These procedures are much safer than open heart surgery. They require lower hospital time, lower hospital stay. They don't require ICU admission, so they of course save money and they save lives.
My area of expertise is coronaries and blocked coronary arteries. So this is without question the most cutting edge thing you can do for coronaries right now. The other thing that's been around and is emerging and evolving is stenting. We still stent. More than half the patients are eligible for a stent. Those that are not eligible for stents are eligible for coronary bypass surgery. And of the ones who are eligible for coronary bypass surgery, right now I'm doing about 99% of them are being done minimally invasive. So that's kind of the good news. The advances that we make are not in the technology, but in the amount of patients we can apply that technology. When I first started doing minimally invasive coronary bypass surgery, I'd do about 10% of my patients that way. Now it's the equipment and the techniques and the devices have gotten so good that I can apply that technology to almost 100% of my patients.
We're now on the cusp of learning how AI is interacting with the tools that we have been using. So now increasingly, we're using AI to fine-tune both the treatments that we're giving and also to help us with the complex decision-making. We can now also ask AI, what do you think? And AI will promote, say, well, that's what we'll suggest, and we'll suggest a strategy. Now, it's not that he's committed to doing that, but it's like having an experienced partner that can give you some advice and you can think about it. And so that's fantastic, especially for areas like in most Caribbean islands where you have few specialists or few super specialists who don't have an even yoked colleague always to bounce ideas off of. Now you can talk to AI and collaborate and disagree. And at the end of the day, the doctor remains the one who makes the decision, but he always feels as if he's surrounded by colleagues who can give him another opinion.
As with many chronic non-communicable diseases, healthy changes in lifestyle can go a long way toward keeping your heart healthy.
It is all about prevention and the risk factors. We've gotten very good at treating heart attacks, at treating heart failure, at treating the end stages of the disease, but we're still behind in terms of preventing disease. The number one risk factor in the Caribbean and around the world remains and will remain up to the year 2050 is hypertension. The problem with hypertension is that people either don't get it measured, don't know they have it. Even if they have it, they feel okay, they don't feel it, and so they don't get it treated. So that's the number one modifiable risk factor right now. We're doing pretty well with cholesterol. People know their cholesterol. The statin drugs are ubiquitous to use and almost free of side effects. And so a lot more people getting their cholesterol lowered. But as I mentioned, there's this rise in obesity and diabetes as the third risk factor by 2050. So we have to get our handle on that. And so hypertension, obesity, diabetes are the areas that really need a lot of work over the next 20 years.
The only way you know or you have information as to what your blood pressure is if you are checking it. So you must know your numbers, you must check your blood pressure, okay? And for those who have got high blood pressure, then whatever is between yourself and your physician, your doctor, whatever decision has been made, then you want to adhere to those principles because they are very good treatment methods that would control the blood pressure and therefore remove that risk or decrease that risk of complications such as aortic disease, aortic aneurysms, aortic dissection. Sometimes you see it in young pregnant women as well during pregnancy. The person, because you know blood pressure changes during pregnancy, sometimes you have women experiencing complications during their pregnancy where they've got high blood pressure. High blood pressure sometimes can occur in pregnancy, and if it's not well managed, you can also develop aortic dissections and complications of aortic rupture.
Exercise is really the best medicine. It's better than any medication that I can prescribe or any cardiologist can prescribe. Getting just simple walking, 7,000 or 8,000 steps a day should be the goal. There are very good studies now showing that's the level of exercise that reduces your cardiovascular risk. So if you can get a smartwatch or smartphone or some Fitbit, some way to count the number of steps you're doing a day and really aim for that 7,000 or 8,000 steps a day, that can control your weight, control your blood pressure, improve your overall cardiovascular risk profile. It's shown to reduce cancer rates as well. So exercise is really the best medicine we have.
One other aspect that's rising is the need to get good sleep. The condition of obstructive sleep apnea is there on the horizon and rising, and we realize a great contributor. So that's the other aspect that I think we need to clearly understand. That's creeping in as one of the things we need to pay attention to, not only diet and exercise, but good restorative sleep.
There are two systems in the body, the sympathetic nervous system that is related to stress, and the parasympathetic nervous system that is related to relaxation. And every time we take a deep breath in and out, we're actually activating the vagus nerve, which in turn would cause relaxation after a small number of breaths. So that this is why things like meditation and yoga are helpful, because they actually help the physiology of the body. We are now realizing that what is really good are the good fats. Not all fats are good, the saturated fats, for instance. But if you were to eat diets that are high in like avocado, which was one time thought to be something bad, olive oil, which is one of the best oils, and the good fats that come from nuts in places like Cuba and lots of the other places, Puerto Rico, because they eat so much rice and peas, they have found that there is less in the way of atherosclerosis. That too, with some meat and fish, will be a good diet. Of course, green, leafy vegetables and fruits, which are around and in abundance, just that they take a little bit more effort to get them on the table. But if you use this will be one of the most helpful things in achieving a long life.
Thank you, Dr. Tilakdari. Good heart health is the key to quality of life. Do take all the precautions necessary to keep your body's engine working at its best. And do be sure to subscribe to our YouTube channel to learn more about caring for your heart and to educate yourself on other medical conditions that affect you and your family. Coming up next, we'll look at the work of the Down Syndrome Family Network of Trinidad and Tobago and their efforts to raise awareness.
Republic Bank is more than just a financial institution. We've been a steadfast partner in the communities we serve, investing in their future through our Power to Make a Difference program for more than 2 decades. Our aim is to drive meaningful change, expand our sustainable footprint, and ultimately build more resilient communities. Our footprint spans 16 territories across the Caribbean, South America, and West Africa. We understand that true success is built on the strength of our communities. That's why we're committed to making a lasting, positive impact. This is why the Power to Make a Difference isn't just about funding. It's about active participation. It's about providing crucial support and guidance to our valued non-governmental partners, empowering them to achieve the United Nations Sustainable Development Goals. By working together, we can create a movement of positivity that resonates throughout the territories in which we operate.
Welcome back to this episode of Caribbean Medical TV. Every year in March, we observe World Down Syndrome Day. Many in Trinidad and Tobago, like the rest of the world, don multicolored socks to help raise awareness. But yet, many people in classrooms, in the workplace, in public spaces, even in our own homes, do not understand people with Down syndrome and how to support them. Over the years, Trinidad and Tobago's Down Syndrome Family Network has made strides to raise awareness and offer encouragement and community to families across the country. For members of the Down Syndrome Family Network, their mission to advocate for families of people with Down syndrome is a highly personal one.
It was difficult in the beginning. I didn't know anything about Down syndrome, so I thought I was cursed, for my son to be born with Down syndrome. And then even realizing after 3 days that he also had congenital heart disease. He had 3 holes in his heart and needed emergency surgery. So, it's almost like okay, what next? What next? I mean, he already has Down syndrome. Now you gave him 3 holes in his heart. Why? What did he do? What did I do? To cause this? And not knowing that he didn't do anything, I didn't do anything, it just happens. And then a friend of mine, we were actually sitting down having some drinks, and I was ranting, and he's just looking at me, and over his drink, he was sipping it, and he looked at me straight in my eyes, and he said, "What are you doing?" And he took a sip of his drink. I wanted to slap that drink out of his hand, and I opened my mouth 3 times, and I could not answer him, because I realized then I wasn't doing anything, so I was a part of the problem. In fact, I was the problem in my son's case. Because I wasn't doing anything to help him. And, so that changed everything.
The result was a collaboration among parents of children with Down syndrome to establish a support network, a means to reach out to those struggling and help them see that their children could have lives full of potential.
I started educating myself. I started attending conferences abroad. And that is where I got the concept of the network, because I'm seeing how those other organizations grew from family support groups to huge international organizations. Some of them are the largest advocacy organization for Down syndrome in the world. And it started off as a family support group. So, I came back, and with some other parents, we formed the Down Syndrome Family Network. And in 15 years, I always used to think that we haven't done anything, but people have to keep reminding me, look what you have done. The government has ratified the UN Convention on the Rights of Persons with Disabilities. They updated the national policy on persons with disabilities, and they have begun drafting national legislation for persons with disabilities. So we anxiously await that, because that is the game changer right there for all persons with disabilities.
The support of organizations have helped to raise awareness of the best means to support families and people with Down syndrome.
Through the Power to Make a Difference program, they support us with our workshops, and we have these workshops quarterly, along with our conference annually in March. where we bring parents together with professionals, occupational therapists, speech therapists, physiotherapists, and even, as we had today in our workshop, a financial specialist from Republic Bank to tell us all about planning for the future, investments, and even starting from basic, from a bank account, and how that could help us plan for our children's future. So, Power to Make a Difference is really making a difference through its partnership with the Down Syndrome Family Network, and we hope that as we continue, they will help add our cries for legislation for persons with disabilities to continue making that difference and changing the lives of persons with disabilities forever going forward.
One of the most dynamic fundraising events for the organization is the annual Fashion with Us, which is a true inclusive celebration.
Today we celebrated the 15th anniversary of the Down Syndrome Family Network and the 4th Fashion with Us program. Fashion with Us was the idea behind creating an inclusive forum for persons with Down syndrome to also model on stage with typical models. We joined with the top designers in Trinidad and Tobago under the creative direction of Richard Young to create a marvelous fashion show. All of our kids over 14 years old are invited to do a model call, and then they come and they practice and have their sessions. Fashion with Us really has elevated the idea of inclusion, because once you can presume that someone is competent and you give them an opportunity to be included, they will show you exactly what they can do. So we are so happy that we were able to bring all of this together again in its 4th year at the Hyatt, and to celebrate diversity and inclusion.
Every year we do a little more. I ask a little more of them. I give them a little more difficult moves. They get more accustomed to the models as well. They understand what they're doing for the designers. So, they're really differently abled. And this is what we need to understand when we're working with people who are differently abled, that their ability is just as keen as ours if you give them a chance. So today was Fashion with Us. It's all about inclusion. We presented 12 fashion houses. We had a cast of over 75 models. We had the top designers in the country. They were all part of it. They were all so thankful that they were included. They were hugging and loving and sharing. And the models, I think it also does something for the models themselves. The models have another responsibility when you're working with a Down syndrome advocate. And so the backstage is just filled with love, filled with cooperation.
Events like this are a showcase of the true potential of people with Down syndrome once they are embraced by our communities.
I will tell anybody with a child with Down syndrome to, search for the children's skills. Don't keep them back. It's not what you want them to do. You have to see what they are capable of doing and push them, love them, because they are really sweet children. They are beautiful children. They can teach you how to be a better person, a better parent.
Support for people with Down syndrome does not begin and end on one day of the year. With the support of family, networks, and community, people with Down syndrome can reach their full potential and enjoy the very best quality of life. Thank you for joining us today on another episode of Caribbean Medical TV. We look forward to seeing you next time.